So here's the scanning electron micrograph. This is looking at the surface of an implant, one of those threads through a microscope. And this is the texture of the surface. And this is absolutely critical. And the big company, it's critical how these surfaces are treated. And the major manufacturers have very complex manufacturing processes, whereas the knockoffs or cheaper versions have very simple, sandblasted or acid etch. And the more prominent companies that have spent millions and millions in research have really spent a lot of money in figuring out exactly the best surface, how to treat this, and how to attract bone cells, use biochemical, all sorts of chemistry and mechanical content to it. Again, here's some more pictures at a micro-mechanical level, and I'll show you a little bit later a diagram that shows how the bone cells like to attach to it. I'm just saying all this to give you an idea of how complicated it is, because you're going to, I don't want you to think that, it's not exactly a screw you want to pick up at Home Depot and put in, okay? So there's a great difference, and there's a great difference amongst manufacturers. Astrotech is a good company. They're Swedish. They were recently bought out, and I used to use a lot of these, but more recently I've used just these this is a US company, and they both have what we call an internal connection, and they don't have the failure or the strength of the internal connection is very good, and they have very well researched and developed surfaces and thread patterns. So everybody's coming out with a better box, but these are, some of the bigger companies. So Astra, this is Biomet 3i. There's another company called Nobel Pharma, which is okay, and Straumann and Zimmer. Those are just about the top 5 companies. Straumann, Zimmer, Nobel Pharma, Biomet 3i, and Astra. And other than that, I'd stay away from it. Not only because, these are better surfaces and have good companies that stand behind them, but, they're not universal. So let's say you went to a practice and or somewhere and you got an implant, and it was a small company and they went out of business, and some part of it needed to be serviced, like if, for example, a screw broke, or if you wanted to change this part here, well, they may not be in business in a couple of years, besides other things. So it's really important to, ask where your implant is coming from and stay with one of the major manufacturers. There's a lot of clones, but there's no, that's what they are. And this is just showing you here kind of comparison of a tooth, and how a tooth feels and how the gum attaches, and what lined up what an implant is. And down here as well, this is an implant, and it goes in between teeth. So the difference between a tooth and an implant is that the tooth doesn't actually fuse with the bone. There's a ligament that goes around that inserts into the surface of the tooth, whereas with an implant, the bone cells directly fuse with the titanium surface. This is some of the research that they're doing. This titanium quickly turns into titanium oxide, and they're thinking of little drug delivery spheres to help increase bone contact as this bone is growing in there. So this is just sort of areas of development, sensors, all sorts of stuff. But really, take-home message is what we have today, if it's a good implant, works very well, and we're there. We have reliable implants. The only people with a history of gum disease or bad teeth That's the only factor that would, except for extreme systemic health conditions, and smoking. Smoking is not compatible. Heavy smoking, I should say. Maybe a little light smoking you can get away with, but heavy smokers tend to have problems with their implants and with their overall health and oral health and gum disease, etc. So if you're a smoker, I would steer you away. This is a regular x-ray showing 2 implants in the bone. This is another implant. And these are, you can count how many implants this person had to replace all their teeth. We'll get into that later, but you don't actually need all that many implants. To replace a whole arch of teeth on the bottom, you need maybe most 6. And if you're going to replace a whole arch of teeth on the top, it's 6 to 8. Some people are out there, and I'm going to talk about it soon, doing fewer than that, but it's very risky and it's somewhat controversial. Using as little as 4, and just making it. So this is a picture of a single implant. This is the radiograph. Somebody lost their tooth, and that's the final crown. So well done. It's indistinguishable from a natural tooth. But if this tooth, we have to have ideal conditions. This gum can't have been receded, can't have had a traumatic extraction, and it also had, there's all conditions have to be done right, and or tissue has to be rebuilt to get an ideal aesthetic situation. This is again an implant on a radiograph. You can see this is a tooth, implant, and a crown. This is just a titanium oxide. This is how what happens originally with the protein and the hydrophilic heads, and how the connective tissue leads and then eventually turns over into bone. But this is the ceramic implant. It's called a Serra root, and this comes from Spain, and this is another one that comes from Switzerland. It's another ceramic implant. And one of the problems with the ceramic implants is that they're straight. So if your tooth the socket is straight, then okay, not so bad. But often when we're and the site that we have just perfectly fits the mushroom. But often what we find is that the tooth, the root or the bone that's left, or the bone teeth aren't straight. If you remember our first diagram, the root came here, and then the crown came like this. So roots and crowns, so we often have to correct for that angulation. And we're able to do that with a 2-piece titanium implant, because there's one piece here, and then we can angle this way, this way, this way, so that we get this part here has to be on bone all the way around. So that's a limitation of a ceramic implant. And you can't have, there is no 2-piece ceramic implants, because this doesn't screw in, or they're 1 piece. So that's worth mentioning. What we use a lot now, again, is going back, is the 3D guided technology, so that, and you've heard a lot about it, some people call it teeth in a day, DM, teeth in an hour. I'm going to get into it a little bit, but we use the images generated by our CAT scan and to pre-plan if somebody's going to get extensive work or just even simpler work, to be able to guide so that we can precisely direct. This is multiple implants to support a full arch, or even just 1 implant into the bone, so that we have a guide, which I'll show you in a minute. This is a planning tool we use. This is my software. I take a CT image, which I'll show you later, plan all these, and then this fellow had no teeth, and then this is a final prosthesis. This is a good candidate, or somebody who's tried to put work in their mouth for a long time. This is an abscess here, and the bone used to come up to here, so it's very not much we can do at this point. So this is a mouth for a candidate for immediate, because there's bone, sufficient bone here, sufficient all here, this is a good candidate. We can evaluate by CT scan for taking teeth out and replacing them with implants. Now, of course, we can always try, we always try and save and preserve teeth, but at some point it becomes more practical and economical to just make the switch over, sometimes. The CT scan, what it does is this gives us cross sections so that we can see this is a 2D traditional X-ray that's produced by the CT scan. So we're looking here, this is a patient of mine, but then I had to evaluate. We put implants here, here, and here, and then I had to add bone up here into his sinus. So there's one myth is that, oh, somebody told me I don't have enough bone. I heard it yesterday. There's no such thing. We have techniques and of grafting bone that have become progressively less invasive, so that anybody just about can get, almost without exception, can get implants anywhere they want in their mouth. We just have to add the bone back. So there's no such thing. If someone tells you, well, you don't have enough bone for an implant and you should get a bridge, that means they don't do the implants and they want to do the bridge because it's what they know how to do. Okay? So bridges really should be avoided because the more teeth you attach, that's with traditional teeth I'm talking, not implants, but the more teeth you attach, if one goes down in the system, then you've lost the whole thing. So here, these cross sections represent these areas here, and I can see how high I need, and it's not quite enough. So let's see if the next slide is here. So this is the same guy, and this is all bone that I've added up in him, and we put all these implants up there. So we just actually add bone. So it's the maxillary sinus is, the bottom of the nose is right above the palate, and we put bone in there, and we get plenty of implants. And it's not very painful, and it's just a little bit of swelling after the procedure. This is another patient. He was done here in the hospital, and as I said, this fellow, he did 6 implants on the top and 4 on the bottom. I'll show you him later, but he's with this arrangement, his teeth were hopeless. You'll see soon, but this is another one with 6 on top and 4 on the bottom, and I'll show you their pictures later. That it's more than enough to support a beautiful full arch of teeth. This person is a little different. Came in and they already have enough bone in some areas. So the CT scan is critical in planning your surgery and being able to assess. And also, not only knowing how much bone you have, but if you can see, right where my pointer is, there's a little hole there. And this is the lower jaw. So this is a slice right in between here. See these green lines? I don't know if you can see them, but it's this area to this area. So these 10 slices represent cross slices here, 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 here. And what this little hole is going through here is the mandibular nerve. So if you don't have a picture of that and you don't see that clearly, and somebody drills too far, you don't feel your lip for the rest of your life. So, that's a pretty big mistake. So if you don't have, you must have a 3D X-ray if you're going to be putting in implant in the posterior of a molar, or up to the bicuspids, or you're going to lose and have a sensitive face. Just a couple more CT scans. Let's see if we can get to some pictures. This shows that, while it has the length, and we'd think from a 2D X-ray, oh, it's okay, we see that it's not wide enough. Why we need a CT scan. This is, again, when we take our CT scan, that data that I just showed that's produced by my CT scanner, and we can produce a surgical guide that tells us where we can put our implants in